Hello, this is your weekly update on the COVID situation in Sheffield. The observant among you will have noticed that I'm not Greg Fell, the Director of Public Health, who's taking a well-earned rest. I'm Ruth Granger from the Public Health team, and I'm going to be doing the update today. Epidemiology. So, the case rate in Sheffield is about 350 per 100,000, which is a high level. It's settled at a high level, and we know that we are likely to see increases with people returning to school and university in September. The case rate is increasing in older age groups as well, and obviously that's a concern. Hospital admissions tend to follow a similar pattern to cases, and it is the case that people are still being admitted to hospital, albeit at a lower level than summer last year because of the protective effect of vaccination. It is fair to say, however, that hospitals and primary care and all health services are experiencing quite a bit of pressure at the moment. So last week there was a change to the rules on self-isolation, and I know that Greg has had a lot of emails in his inbox with confusion from people about what that means. I think the most important thing remains that if you've got symptoms of COVID, get a test, and if you're positive, stay at home and self-isolate. The difference is that if you're an adult now and a contact of a positive case, then you still need to go and get a PCR test. But if it's negative and you've been doubly vaccinated, or you're exempt from vaccination, or you're under 18 and a half, then you don't need to self-isolate anymore. But please remember that if you've got symptoms, you do need to self-isolate and get a test. As a lot of you will know, the school year starts next week, and we're prioritising a return to face-to-face education because it's really important after the disruption from the pandemic that children and young people get back to face-to-face learning. Schools and education settings will continue to work to provide a safe environment for your child, and most restrictions in schools will be removed, but testing will still be important. So secondary school children will take 2 lateral flow device tests at schools or colleges 3 to 5 days apart as term starts, and then we'll continue to test twice a week at home until the end of September, when that will be reviewed. You might need to check what time your child needs to attend at school, because schools are changing times to help manage their on-site testing. Still really important though, if your child has COVID symptoms, they must stay at home and get a test. One of the things that's changed from the 16th of August though is if your child is a contact of a positive case, they'll need to get a PCR test, but if it's negative they can keep going to school or nursery, and we know that's really important for reducing some of the disruption to children. Another thing that we can all be remembering, including children and talking about with children, is to wash our hands regularly. It's a really effective way of preventing transmission of diseases, including COVID and including other things that start to be transmitted in the autumn. So, vaccination. In Sheffield, 77% of 16 and overs have had 1 dose of COVID vaccination, and 67% have had 2 doses. Really encourage the 160,000 or so people in Sheffield who haven't yet had a second dose to get vaccinated. And also 16 and 17-year-olds are now able to go and be vaccinated and having 1 dose of the vaccination at the moment. And it's a great time now to get vaccinated before term starts. We know for young people that long COVID does affect young people as well as people across the age spectrum, and the best way to avoid getting long COVID is not to get COVID, and the best and most effective way not to get COVID is to get vaccinated. So there's lots of different options about where you can go to get vaccinated. There's the Longley site, which is the old blood and transplant site, which is open for booked appointments during the day and also for walk-ins. If you need an appointment in the evening or at the weekend, there's the Darnell Primary Care Centre, which is open 7 till 9 on weekdays and 9 till 4:30 on weekends, and they also welcome walk-in appointments. Pharmacies and GPs are also offering vaccination, either by inviting people or you can book by going on 119. So there's lots of different options to take up your offer of vaccination. Now, if you've recently had a baby and you chose not to be vaccinated when you're pregnant, it's not too late to get vaccinated now. All vaccination clinics are family friendly and you can bring little ones with you. If you're breastfeeding your child, the Joint Committee on Vaccination and Immunisation have said it is safe to get vaccinated while you're breastfeeding. And a final offer of a vaccination pop-up clinic that's running this weekend is at Meadow Hall on Friday and Saturday, so you can attend there without an appointment. Thanks very much.